As COVID-19 cases continue to surge in the Palmetto State, we've got details on the latest numbers today. DHEC reporting 5,229 new cases in the state, 60 additional coronavirus-related deaths. The percent positive in South Carolina now stands at 14.5%. Also in the state, hospital data shows that beds are filling up, and it's causing a strain on the healthcare system. News 19's Emily Carell has a closer look at those numbers.
Currently, South Carolina is the #1 state in America in terms of rate of COVID spread. That's a stat that we don't want.
John Williams is the Director of Disaster Preparedness at the South Carolina Hospital Association and has been working overtime to get the state's hospitals all that they need as our state's COVID-19 numbers continue in the wrong direction, leading to record hospitalizations across the state.
Right now, South Carolina Hospitals is seeing a major uptick in hospitalizations. Our hospitals, emergency departments are rapidly filling up. And we're seeing that most of the hospitalized patients are the unvaccinated.
According to data from individual hospitals, Lexington Medical Center is at 90% occupancy, with 178 hospitalized and 57 in the ICU. A spokesperson tells us the COVID-19 surge impacts the delivery of health care throughout our hospital network. Lexington Medical Center has had to temporarily suspend some elective surgeries in order to care for COVID-19 patients and keep beds open. Prisma Health has 494 hospitalizations, 111 people in the ICU, and 72 on ventilators statewide. And MUSC says their ICU beds are at capacity along the coast and here in the Midlands. And what happens when these hospitals meet capacity?
When hospitals reach capacity, we find ways to try to decompress that hospital. We try to find ways to cross-share the load. Many hospitals are maybe not as full as others and have bed availability, but not staff. So staff continues to be the Achilles heel for us. What people need to know right now is that our clinicians are reaching peak burnout as they continue to treat patients who dismiss their advice and refuse to accept the COVID-19 vaccine.
Williams says they are working with DHEC, the Emergency Management Division, as well as the governor's office to supply these hospitals with every resource possible. I'm Emily Carell, News 19 WLTX.
News 19 did reach out to the governor's office to see if another state of emergency will be declared due to the rising hospital numbers and increasing COVID cases, but we have yet to hear back.